Good. So Sheree Wallace, our speaker this morning, is a community health worker. But even more importantly, she is the founder of the Meadowwood Health Partnership, which connects people to a variety of resources. I'm just going to read you one of the things that describes what she does in a very minimal way. Sheree and the Meadowwood Health Center provides various resources, information, and community learning opportunities. Through her efforts, the Meadowwood Health Partnership is a one-stop shop for communities' health and social service needs for clients. And it's a place where people's barriers and circumstances do not make a difference. I would also add that if you're interested in following along with the work that Sheree does, there's a lot of information online. So Sheree, I turn it over to you. Your story is inspiring, and I look forward to hearing it again.
Thank you, thank you. And I want to say the work that I'm doing and the foundation I've have created. I feel good about standing with my community, listening, educating, and advocating for a better health and well-being as a community health worker. Um, I grew up in the city of Chicago. I was raised by my grandmother in a house where my grandfather, he was white. My grandmother was a Cherokee Indian. Um, my grandmother had 5 kids, and I lived there. We had a two-flat building where my grandfather raised his grandkids. And growing up back then, as a very tight knit family, we had opportunities to do many things culturally. I love fishing, uh, eating fresh vegetables and fruit. So a tour, I grew up around 17. I graduated from high school. And I come home, my grandmother was in bed and she was really sick. But prior in May, my grandmother's daughter, her name was June Baby. She died in May. And my grandmother, that was my grandmother's youngest daughter. She got really ill behind that. And in June, I come home from school. My grandmother was in bed, just laying there, and looked different to me. I said, I was trying to talk to her. Her mouth was twisted. At that time, I didn't know what was going on. I called the ambulance. They rushed her to the hospital. My grandfather and I was there at the hospital, and I was trying to uh, figure out what had happened, what went wrong. And I'll never forget the doctor coming out telling us that we had to make a decision. She was on a life support system. Her body was shutting down. She had sepsis. And my grandfather said to me, I can't make that decision. You will have to make the decision. So, me, I'm not, I wasn't educated. I didn't know what was really going on. I knew that I had to say, take her off the machine. I did that, and my life has was a blur ever since then. Next step was uh, trying to get the funeral arrangements. I did the funeral arrangements. My grandfather said he wasn't able to do that. So I never really processed what I was doing. I was just doing things because he told me. And, by me being the oldest grandchild, Next thing I know, we had the funeral right before we leave the cemetery. My grandfather said, um, I'll be next to my dear next, And I was like, what are you talking about? You're gonna be all right. But when you've been married to a man for 50 years and you have trained him to wake up at a certain time, cook him breakfast, have Folgers coffee ready at a certain time, and he sit and listen. They would tell the same old stories all the time. He missed that, and the next it was May, June. May, my auntie, June, my grandmother, and July on my grandmother's birthday. My grandfather said, we're gonna celebrate Medea's birthday. And he said, tell everybody to come downstairs. We're gonna have a celebration. I went upstairs to tell my auntie and my other cousins that we were celebrating grandma's birthday. And the first thing they noticed was alcohol. And what they said, who brought that alcohol in the house? My grandmom didn't allow you to drink, and you couldn't drink in her house, right? So everybody was like, we're not drinking that. We're not about to drink in the house. It was funny, right? So later on, as we were talking, my grandfather had gave me CDs, these CDs, about 50,000, I want to say. 20, it was two $20,000 CDs. I didn't know what they were. He began to tell me about how lonely he was, and when your heart hurt and you can't stop it from hurting. And he asked all of us to go fishing with him. And we all agreed because we just felt like, hey, maybe that would make him happy. Next morning, I got up to do what my grandmother did, was cook breakfast, then wake up everybody. I went in my grandfather's room. My grandfather was dead. That his he had a smile on his face. Hands felt like rubber. And the strangest thing about it, he was in my grandmother's bed. My grandfather never slept in my grandmother's room. He slept in his room. They slept in separate rooms. Then life started, life began to be real for me. I couldn't go, I had enrolled into Luke College, which was began to be Harold Washington. One day I got on a L, but prior to that, remember I was saying my auntie, she passed, she had 5 kids, right? So I'm in a house with 5 kids trying to figure it out, just doing exactly what my grandmother taught me, as far as keeping the house up, cleaning and everything. So now it's time for the bills. I didn't work right. So I didn't have that part figured. And I had these 2 little blue books, and I didn't know what it was. I got on a L, and I was leaving school, got on the damn Ryan L, took it all the way to the end of the stop and got off the L. I'm still in a daze. And I was by 2 Grosse Point Road in Chicago. That's the suburbs of one of the suburbs in Illinois. I walked to this Orthodox Jewish nursing home. I didn't know what that was neither. And I went in and I asked this lady, I said, do y'all have any job openings? She said, what can you do? I said, anything that you teach me. And I told her my story and what was going on. She said, I'll have Mr. Novak call you later. Mr. Novak called me and I went in. He gave me a job. I was part-time receptionist. Then my supervisor, her name was Verna Siegel, and she was from Upper Michigan. She never really had a lot of close contact with Black people. So Verna began taking a real great interest in me and my family, the 5 kids of my auntie. On the days that Verna was off, she would send a limousine to pick me up, to take me to the mall and take me out to eat in Mount Prospect. And I would say to her, that's embarrassing. Why are you bringing such big car? And she said, because Sheree, you're going to be something and you're going to have things and you're going to know how to appreciate and take care of the finer things that you have. You deserve this. So, Verna, I stayed there for 10 years. She put me through many trainings in healthcare. I learned medical records. I ended up being a supervisor of medical records. Verna moved on and she was administrator. Then I decided to move here to Madison. I had a sister that stayed right on Balsam Road. So I moved over here on Balsam. I had a mother, but my mother didn't raise me. My mother moved on with her family and her husband's family. She lived here, but we only had a month to be around each other. And she had a stroke. She was in St. Mary's Hospital, and I'll never forget this. And deep inside, I was angry because you can raise one set of kids, but you couldn't raise me. And that was a problem between my sister and me. We always, didn't really see eye to eye. And maybe deep down inside, it was me feeling some kind of way. So my mom, I go to the hospital, right? And my mom came up out of uh, this little coma she was in. Her body was breaking down, and she asked my sister. She said, "Can you leave?" And she asked her husband, "Can you please leave the room? I need to talk with Sheree." And she grabbed my hand and she said, "I was a kid having a kid, and I done wrong by you. Could you forgive me?" And just then did I have that mother that them ladies instilled, my Jewish mother, my white mother, my grandmother. I I just had that mother that I wanted when she said that. She gave me peace, you know. So after that, me and my sister tried to build a relationship, which we did because at that point, she lost everything that she knew, her mother, and I lost my mother. So it was one Friday, about 2 years later, after our mom passed away. We was on Boston Road, and the doctors called my sister, and they told her, your potassium level is down. And my sister said, oh, I'll just wait till Monday and I'll go to the doctor. I'm not knowing. I said, well, if they called you, I think you should go in. But I was going to Chicago at that time. One of my coworkers at the nursing home husband had passed, so I was driving to Chicago that weekend. And my sister always loved for me to bring her Harold's chicken. So when I'm in Chicago and I'm at the funeral, I always go to our family church, United Faith Tabernacle. I goes to the church. A lady walks out the door, and I'm shocked because usually it's a lot of cars there. And the lady said, "Oh, Reverend Treadwell is at a visiting church because his son is doing his first sermon today." I go over to the visiting church, and my cousin said, he was happy to see me. He said, "Is there a casket following you?" And that's he said that because we always when he always seeing me, he preaching a funeral, right, in our family. So I said no. He said, "I'm not preaching today." I said, "Okay." So he wasn't able to preach. His son stood up, and his son preached a sermon, and it said, if somebody in here life is going to change, he said, you may think that you went through something before, but it'll be different this time. And I just started crying, and I was crying. I couldn't figure out why I was crying. So I got back on the expressway headed back to Madison. I stopped to get my sister her food, and she was outside barbecuing. I said, "Here's your chicken." And the look on her face, she looked so different to me. She said, "Come on, sit out here with me." I said, "No, I'm real tired." I went and laid down. I got up the next morning because I did home health care. So I was coming back from my client house. I see all these polices. I see all these, my husband coming down the street toward me with the police. And the police said, "Sheree, um, we need to talk to you." I said, "Oh." I said, "What's going on down there?" They said, "It's your sister." I said, "Oh, I know what's wrong with her. Her potassium level was down." They said, "No, we need you to come and identify her body." I went down there, and my sister, 5 kids, was over her. And they were screaming, "What we gonna do? Auntie, what we gonna do? What we gonna do?" I said, "You know what? I've been through this before. Remember when I said I was 18, 17, and my auntie, she left 5 kids. Now my sister, she done left 5 kids." I was headed to work one morning, and I'm God just led me to Upper Iowa School, University. And I went there and I said, I need to, a man was standing in a hall. His name was Steve Stein. He was over psychology. He said, "Can I help you?" I said, "I would like to enroll in school." And he said, "Okay, what would you like to major in?" I just picked up this brochure, and it was psychology. And he said, I'm over that program. So I ended up graduating with a bachelor's degree in psychology, a social worker degree. And then I went to, I did a lot of work with the community over here because now I need to figure out what's going on in my community. You know, it seemed like more people, my sister passed away, her friend ended up in a wheelchair. So a young man, 16, dropped dead on our block. Uh, Mayor Soglin sent out public health workers. I began to help with the trying to get information and help people in the community through working with public health. So that's my journey of becoming a community health worker.
I have to tell you, when you told me that story when we first met, listened to you. I said, "Oh, that's a shame. Oh, that's too bad. That's tough," you know. And then I heard you coming up to Madison, and here you were once again, responsible for another family, responsible for more children. But what you had lived through, and without knowing anything, I think, Sheree, you determined that nobody else that you knew was going to have to walk through problems like that without having resources, without having people available to them. And you became that person in your community. Um, and for you, those of you who don't know, um, the Sheree is a walking embodiment of what it means to take care of people. Through her organization, that she started working just through the community center in Meadowwood. People walked in that were sick and didn't know what to do about it, didn't understand anything. Sheree, you've educated, talk about that. Talk about how you've educated
Oh,
people who are ill about their illness, and about the interns from UW that come and learn from you too.
so after all that, I liked it how public health worked. So I decided to. I was mentored by Betty Banks. Then Dr. Jonas Lee said, Sheree, you are working so well in the community and you're trying to help people. You could be a community health worker. So I went to Pastor Joe at Good Shepherd Church, and the class was like $3,000. And I told Pastor Joe, I said, Pastor Joe, I want to take this class. I think it would benefit me and the community. He said, okay, Sheree, we're going to help you. So thanks to Good Shepherd Church, I would work nights and go to Milwaukee in the daytime. And I did this and received my community health certification through AHAC. I came back, I created a survey because I give community suppers every 2 months. And in my community suppers, I bring resources to the table. I started getting connected. Once I got connected with public health, I started focusing on the chronic diseases. I I did a survey and I asked people, I said, if I had a community health office in a library, would you come? And out of 200 surveys, everybody said yes. And then I put a list of chronic diseases down and I asked, what would you like to learn? A lot of them was about hypertension, diabetes, asthma. So today, That's what we do. I give table talks, and I always have 15 cohorts of people, and we go through table talks. Uh, Not only is they learning, but they learning each other, being neighbors. Uh,
Yeah.
it's important. I always said I want to stabilize a community because the community we live in is two separate communities. It has the the homeowners and the renters, the well-to-do and the underserved. My model of stabilizing the community and bringing people together, it was very effective because I was able to bring the older people to community suppers. And most older people in our community end up home alone. Their kids leave, they there. Then if they live in a community where there are renters, they don't know who's around them, or and if the people have young kids and they gathering, they outside, sometimes it makes people feel uncomfortable. So I was able to do community meals every 2 months, build up the relationships with the renters and the owners, able to teach about chronic diseases. Then I had an opportunity to work for Center and Patient Partnership. Meg Gangs, a beautiful lady, um she struggled with cancer, and they told her she didn't have long to live, but she beat those odds, and she made an organization somewhat like mine, based on, she knows that having cancer, it was not a lot of information out there, the insurance costs, support, people need support. So she based that around that. I had an opportunity to train other UW students, which I have two working for me. One is going to be a doctor, and she's going to be the best doctor anybody ever seen, because she's going to be able to understand all her patients. Then I had one's going to be a public health nurse, and she's going to be able to walk in any community and be effective public health, understand what that community is going through, be able to bring resources, meet people where they're at. So that's basically medical health partnership.
I have to say, and again, I was so impressed with how you just did things. You connected people, and pretty soon people that you connected with other people, and you enriched your community. The thing that I find most fascinating is your understanding of the elderly in your community who were so isolated, the people who were ill in your community who didn't know anything about their illness or where to find resources, or for heaven's sakes, just didn't know how to fill out the paperwork that's so insidious. But you managed just all by yourself and to touch other people who then touched more people. And that is a very rich community. And I'm aware of it because I know that there are some halfway homes there that people I work with are in. But Sheree, it is your Wednesday noon table. Would you talk about that, please? Every Wednesday at 12 o'clock in the library, in the
Yeah,
health center.
my Wednesday noon table talk. That's where I have my interns present presentations. Uh, I have outside professionals come in, speak with the community. I have physicians come. You know, if you look at it, when we go to the doctor office, we have 15 minutes, right? At any given moment. Here, what I do, I teach people how to track their information, write their information down. Now I'm showing them how to put it in my chart. So when they go to the doctor, it could be a very effective visit. You know what I'm saying? Uh, because most times when people go to the doctor, they want them to help them, heal them right now. They're in pain. Help them do something right now. But they don't understand that pain that got them right now had to build up from something. So my interns do the table talks, and I understand that people are struggling out here. It takes a lot for people to give their time out of the day, especially if they worried about eating, if they worried about paying bills. So I compensate people. I give them a $25 Woodman gift card. So now you got out to learn about your health. You came out to socialize, and you were able to go back and put a meal on your table.
It sounds so simple. But I am, and this is what I wanted all of us to think about. You're just one person. You've created an environment where people who are in need or who are frightened or who have no one can come and feel part of the community, where you're helping them be healthy, understand nutrition. But wait, there's more. I know that you also are connected now to people who provide housing, stability, jobs. You help with rent payments. I mean, but I asked you a question again when we met. I said, Sheree, um, I know somebody who really needs help. And you said, well, tell them to come on Wednesday. And then we talked about the fact that uh, he needed a place to live. Uh, and you said, I am not an enabler. And I was
No,
shocked to hear you say that. And I said, what do you mean? And you said, when somebody comes to me and says, hey, Sheree, I don't think I can pay my rent this month, you say, do you have
right.
a job?
Do you have a
Or,
job?
Sheree, I can't pay my electric bill. Do you have a job? You are not an enabler, but you connect people then so that they can take care of themselves.
And
Very impressive.
that's important. Doing this work, um, if I gave you rent, and I'm able to help people with rent, and I do, but you just can't come and ask me to pay your bill this month, because it's a reason why you can't pay your bill, and we need to bring that elephant out. So maybe you're not working. We have a job program I'm connected to. So that's one step. Please, let's get you the help you need. So participate in job shop. You know, uh, I'll ask you this. If I paid your rent this month, how you gonna get your rent paid next month? They can't give me an answer. That's not a good investment, you know. And when I say an investment, it's not even an investment. I feel like when people donate their money to me to help people, you want to know, because you worked hard for your money. You want to know that this went to good use. This helped somebody. Most times it do go to, when I help people, it do go to good use. There are stories and um, compelling stories that I have that would show that, wow, I helped her and I made a difference, and my donors made a difference. I track everything. I write everything down. People donate to me. I give them, hey, I spent this money on this because it's important to be transparent. It's very important. And I feel good when I can see I helped 10 people this month. I helped 10 people not be homeless, 10 people able to buy food. I don't discriminate on who I help. You know, I had in housing, I had this lady, and my heart just goes out to her. She's an older white lady, had been in her place for about 30 years and has a disabled son. And when the pandemic came, she had her income, but I don't know if y'all noticed, the we don't have rent control here. And so
Right.
the rent went up. She wasn't able to pay her rent. The management company asked her to come and see me. I was able to get her rent paid for 2 years. But like I say, I always ask questions. So if you can't afford it now that we're doing this pandemic, how are you going to be able to afford it afterwards when there's no money? I said, what we need to do is work on getting you a place that you can afford. So I reached out to ADRC. I reached out to retirement places. Uh, I filled out low income housing for her, which I end up doing the low income housing because she wanted her son, her disabled son, to be there. And doing all that, my little friend had 2 heart attacks, stressed out because receiving that federal government money, it was late. So the landlords were pressuring tenants, about being late, which I understand because they have bills to pay too. So she ended up having 2 heart attacks. And I can say right now, today, she's in a stable house and she's doing well with her disabled son. And we got someone in there to help him, you know. So her it wouldn't be so hard on her being the age that she was at. So every time someone comes to me, I need to know the reason why. I need to know how I can help you further than giving you. Because me just giving you is not helping you. I need to get down to what got you there.
That to me is the most incredible thing, because yes, people can refer people places or they can be advocates for them, but you are concerned about the entire person. You're concerned about how healthy they are, how they understand their health situation, what their future holds. You take care of the whole person. You don't just hand out something and let it go. That's how you've enriched that whole community. And the most amazing thing, when I first stopped to see you, I walked into the library and I asked to see you, and they said, oh, well, you weren't there that day. And then they made sure I had the information to get in touch with you directly, because they knew no matter what kind of person you are, that if you
Mhm.
ask for Sheree in that neighborhood, Somehow she's going to be in touch with you and she's going to see you through. That's the key. See the people that come to you, see them through. And what you've done is make other people help other people. That's, to me, you are a community enricher,
Thank
among
you.
other things.
Yes. So do y'all have any questions?
Anybody? Yes.
Okay.
Sue, unmute yourself, Sue. Sue, unmute yourself.
I'm trying.
Oh, there you are. You got it. Go ahead. Oh, now you're muted again. Sue, you're muted again. Can we unmute you? Barbara? Wait a minute.
Sue, we cannot
Wait a
hear
minute.
you. You
Okay.
need to unmute, please. There.
Okay, I am now.
Got
I
it.
had a message that said the host wouldn't let me do that, so I'm sorry. Okay.
Okay.
I'm sure you said this already, but I missed it. What's the name of the library, number one? And number two, do people have to sign up to come to your Wednesday lunch talk?
You know what? I would like people to sign up, but you don't have to. And the reason why is because I do it in cohorts. So, like a group of 15, we'll do chronic disease, we'll do heart, cardiac, we'll start so at a certain subject, and I'll take them through a series of subjects. And I'd like for them to attend all of the classes because we do pre and post tests. And then I'll know how many gift cards to buy. So yeah. And it's at Meadow Ridge Library.
Thank you.
Yeah.
And it's on Raymond Road, just near Whitney Way. And I also want to say, Sheree, that if any of us were interested in just sitting in on one of your tables, so that we could learn to replicate that in other neighborhoods, would we be welcome?
Yes, anytime.
Thank you. So, good. Other questions, anybody? Again, Sheree, I just want to emphasize that it was your childhood and your own ignorance about what you needed to know to do the job for your family, of multiple generations, that clued you into the fact that people just don't know how to get things done. And the people who don't know how to get things done, it doesn't necessarily matter whether they're, as you said, renters or homeowners. We all have that need, and you are a place to turn to. So that could happen in every neighborhood. Imagine the connections, and we'd have that beloved community. Mary Ann, do you know how to mute yourself? Just, yeah. If you just click on that little microphone, you can mute yourself, unmute yourself. No? All right. Can you put it in the chat? Is that what you do? There.
Okay. Most of my funding comes from UW, Roots to Wings, private donors,
Yes.
THC, Merida, Unity Merida, yes.
And during COVID, when you were designated a community health worker, then you had a grant to begin to have different facilities for donating, right?
Right. So during COVID, that was really that was real interesting. But God put forth in me to first of all get over the fears that everybody had feared. And it was about being outside. I knew that I had clients and working with patients, Winger Northeast Clinic. I knew that uh, these patients would need some support, right? So what I did was I would call at least 20 patients every day to see what was going on, how can I help them. Uh, I would buy laundry detergent, diapers, get gift cards, bus tickets, and they would place their order. And every morning I would get up and I would tell them, when I call you, come out to the car. And I would hand them the items. Uh, I remember going down the belt line, especially when COVID first hit, the highways was so empty. You know, we had to stay in. So that's what I did. Then I had private donation money. I would call the landlords in Meadowwood and I would ask them which of the tenants that's been here struggling right now. Ask them, do they want me to help? And give me a list of how much they owe. Um, Mr. Hornick, he owned it, a lot of property, Commonwealth. So they gave me a list and I paid off the ledger. Then when the federal government money came in, they were able to get extended year because my private money had supported them the first, couple of months. So that was unique because it wasn't a lot of people in our community got evicted. So
Yeah.
that was me thinking quickly and thinking of my community and how I was going to stabilize the community.
That's amazing. And I think, just your example, you knew 20 people who were in need, and you took it upon yourself to take care of it. And I know that, you have donors, but many times I know in the beginning, you paid for things out of your own pocket, or you found somebody
Yeah.
to help do it. You see, and I think we're all capable of that. We just don't think to do it. So as far as I'm concerned, you're an example of how we can do good things during these really tough times, and make our community great if we can't make our country great. Mary Ann, now you're not muted.
I'm
what do
not
you,
muted. I did put it in the chat, but I wanted to know, are the luncheons, once a month? Are they weekly? How often do you hold those lunches?
So the community suppers are every 2 months. We have
Okay,
one coming up April the 16th at Good Shepherd Church, 5 o'clock. I started that over 8 years ago and I cook. I take a whole day. Now I have my staff with me and we take a whole day cooking and we make it beautiful. We make put tablecloths on the tables. Um, we the food, the presentation of the food look like you at a 5-star restaurant. We have resource tables and everything is free. It's beautiful. And I get a lot of people coming in to eat, talk. We enjoy ourselves. And I enjoy myself cooking. I get a peace of mind. And then it feels good to be able to have kids and families sit together as one, all of us up under the same roof. And when the kids see me out, they know who I am. You know, they when our community supper, families, I always cook a lot. You know, being having to have cooked for 5 kids, you keep a big pot. That's all I got is big pots. I don't even know how to cook some for 2 people. So families are able to take food home, and it's just a nice event. I always decorate food presentation. I got people serving the food, and you just there to enjoy yourself.
Thank you.
So
That's
I want to see you at my next community supper, April the 16th.
April 15th. Okay, all right, got it.
Please come.
I would love to. Anybody else? Well, I have to tell you, Sheree, this is, I'm going to continue to be in touch with you because I'm learning from you, and I think we all have learned a lot this morning. Just, as I said to this on my email, this is just one individual, one person in a community who had no connections to begin with, just reached out when somebody needed help, and it grew like topsy. So I thank you for sharing your story with us. It points out once again how important it is for young people to be educated in how to live in this world, and that's what you did. So thank you. Have you any other good words for us?
Please, if y'all, I was just thinking about how the name of your organization. I want you all to think about this here thing we going through, this systematic oppression. I want you to make a difference in our lives by advocating for policy change, investing in underserved communities, helping people that's doing the work. That's it.
Thank you. Thank you so much.
Uh,
Yes,
I
please.
would thank you so much. I haven't said a thing, but the humanity that how you have learned just from your soul, from what your life was, it's pretty profound impact you're
Mm.
having. And
Thank-
it's inspirational. I
Thank-
appreciate it.
Thank you.
I also want to add my 2 cents that Sheree and Hooray seem to, they're such good pairs. The rhyme there seems more than coincidental. I know a woman whose name is Osha Handy.
Mm.
It's like, clearly, you're an inspiration, and I think it's wonderful that that you had the guts to take on the task of learning what you could do to help yourself and much more. I
Thank you.
think there's something very empowering about getting help and then passing it on. So
Mhm.
thank you so much
Thank
for
you.
all you do.
Thank you. And God put it forth for me to be able to have my own space. So right now, I'm sitting in a space where community members can walk in, and I'm here for 8 hours. So I'm very proud of that. So thank you all. I enjoy talking to you. I hope to see you. I hope this is not just a one-time thing. I tell my story. I hope that you come and sit down and eat with us, get more involved so you can see how a community can be when everybody works together. Because that's what we need.
Thank you.
It's not enough love in the world, and that's why it's going the way it is. no, we need to be different. And that is being a part of each other's life so we can finish living out our life peacefully.
And happily, thank
Yeah.
to you.
Thank you.
Thank you, Sheree. I'll be in touch. Thank
Okay.
you.
Thanks.
Thanks. Thank you all too.